we knew definitely that we wanted to have kids, and I had been on birth control pills for so long that I decided to get off of them. And pretty quickly after that, I noticed that my cycles just immediately became completely irregular, and I felt in my heart that there was going to be a problem. But I waited about 9 months, maybe 10 months, to see my OB, and when I saw her, she told me that, we really hadn't been trying for a full year, and to give it a few more months, but that she would go ahead and start running tests on me. And so the first few tests she ran came back, kind of questionable. So she continued to run tests and suggested that my husband also be tested. And so he had his tests done, and it was a little over a year ago at that point. His tests came back also questionable, and at that point she suggested that we see further help, and she recommended Dr. Goldstein to us. So, well, as soon as I found out that there was a problem, I immediately called the office. I called the office before I even called my husband to tell him what the OB had said, and there was an opening for the next morning, and so we both came in the next day full of questions and scared and just anxious to get some answers and just some hope, because at that point I was starting to lose hope. And it was great. He immediately put our mind at ease, I think, and assured us numerous times that we would get pregnant, that we would be pregnant. It was just a matter of when, not if. And that immediately we clicked. I just knew that he was going to be great, and he was going to really help us. So.
Certainly after initial evaluation, went into his office afterwards, at which time he was very open to explaining his thoughts, his approaches, or approach for what he thought we would need anyways. Very clearly defined everything that we would need to know, as well as when we were concluding the conversation, just continue to reiterate and ensure that we understood everything that he was explaining to us, and definitely didn't want us to leave unless we understood and had all of our questions answered.
Yeah, I never got the feeling of being rushed out of the office like I do so often with other doctors.
Certainly.
That's great. How would I describe his approach? As aggressive as you're comfortable with, and as passive as you're comfortable with. He really took into consideration, I think, our feelings and our wants and desires. He weighed all sides of it. I told him about our insurance dilemmas, as far as, well, my insurance covers IUIs, but they don't cover IVF, so I'd like to be as aggressive as possible with the IUIs so that we don't have to get to that route, but he was never overly aggressive. You know what I mean?
It wasn't okay, this is what you guys need to do. This is the path we're going to go on. It was, as you just said, there were many options, insurance coverages, things of that nature, and it was, let's develop a plan together. It wasn't, this is what we need to do, this is what we're going to do, and that was very comforting and reassuring as well. For us personally, especially, it was very nice to have that kind of laid out and to have, a part of that decision, not just a regimen, if you will.
And I loved that in each step of the way, he was always ready to evaluate, okay, how did this work? How did what we've just tried work? What can we do different the next time around? It wasn't just, we're going to try this 3 times. I don't, care what the results are. I don't care how effective or ineffective it was. We'll try this 3 times and then we'll move on. No, it was, we tried it the first time and he said, I noticed that this just really wasn't doing it. We're going to alter it next time, and and that really reassured me. It made all the difference in the world. I know that when I had talked to my OB previously, before being referred to Dr. Goldstein, she had said that she would put me on Clomid for 3 months, unmonitored, and just see how that worked. And that really concerned me. I thought, why would you try something for 3 months without even knowing how effective it was? And his approach was very different than that. He was always observing and altering the next month's course of action based on, how effective it was for me. And that showed that he really cared and he was paying attention to me. Well, at first it seemed like it was happening so fast. After that initial appointment, we had this great plan down. Just as soon as I started my next period, we would just get going on the treatment cycle and do our very first IUI in January. And after hearing that, it was just, we just laid in bed at night and we were like, wow, we'll be pregnant in January, and this is all moving so fast. And we just had this completely different outlook than from what it actually was. Instead, I immediately developed large cysts on my ovaries, and so we had to sit out for about 3 months of treatment. Instead, I actually had to go back on birth control pills, and that was really frustrating. And we were finally able to start our first treatment cycle in April, and which was successful. And so we just thought we were just one of the lucky ones. Unfortunately, that one ended in a miscarriage that was really, really hard, I think, for both of us. I know it just completely flipped my world upside down. I wasn't prepared for the pain that would cause. I just thought, I don't know, I never, I guess, really empathized with women who had gone through it until it happened to me, and it was really hard. But again, that was another way in which this office has completely changed my life. Linda, the nurse here at Dr. Goldstein's office, and Dr. Goldstein as well, both suggested and recommended to me a mind-body and fertility program, and they had recommended it from the start when we first came in, just as a suggestion of one of our many options. And I put the card in the back of the folder and didn't really think twice about it until I had this miscarriage. And I would come into the office for blood work and just cry. The emotions were just free flowing. And, Dr. Goldstein was so wonderful, and the office staff was so wonderful. And Linda gently suggested it again, that maybe I might want to think about it. And I finally was ready then. And it changed my life. It changed my outlook for sure. And I think that it gave me the skills to cope. It didn't take the pain away, but it helped me to control it and to not let it get so out of hand to where I didn't feel like I had a grip on my life. And it helped us to move forward so that ultimately, after one other failed IUI, on our third one, we were able to get pregnant. And I attribute that a lot to this wonderful mind-body program that we did. The mind-body program was just amazing. It's a 7-week series that is moderated by a psychologist, and she brings in a couple different specialists. There was a yoga instructor for one of the lessons, which was really great, and a nutritionist. And each week is a different skill that can help you cope with stress of infertility. And actually, I've realized that it can actually help you cope with other stresses in your life. I've used it when I'm having a bad day at work or I'm stuck in traffic. It's worked as well, but in this particular case, it really helped with infertility. In addition to that, it's also a group of women who are all kind of going through the same thing. In my particular group, there were 5 of us, and 4 of us had miscarriages, which it's just amazing to be able to talk to other women who've been going through the same thing, who not only had a miscarriage but are also going through infertility, and vice versa. And the skills that we learned, and just being able to learn these coping techniques and relaxation techniques, they've just changed my life. And 2 of the sessions included our husbands as well, which was a really important part for me because in your relationship, it's also hard to deal with the infertility and the miscarriage. And I realized that in a lot of ways we weren't communicating about the really tough stuff. We kind of skimmed over the hard parts of it. And so this wonderful program really helped us, I think, communicate better, just open up and helped our relationship even better.
There were certainly exercises that were taught during this program when the guys or husbands were a part of it for the 2 sessions as well, that I got a tremendous amount of myself. When she first told me about the program, I thought it's something that she would go to, it would help her, and that would be great. She certainly needed it. Now, we both needed it, but I wasn't thinking about me. I was, certainly happy that she could find something like that and that she thought would be able to help her. Well, in participating in 2 of the sessions, I got a lot out of it myself. And that was certainly something that I wasn't expecting, but was very grateful for as well. And as you just said, that there were certain communication exercises that we learned there that certainly helped going through the coping process and getting us ultimately to, wanting to jump right back into continue trying as well. So that was certainly helpful.
Yeah. I feel like it helped us get pregnant when we did. That if our mind wouldn't have been in the right place if we hadn't have done this program. And I've met lifelong friends that, women that you root for and you just really, you support, and they're supporting you. And even while we were going through the program, we had one failed IUI, as many of the other girls in the group had gone through failed IVFs or IUIs while going through the program. And, we were there to support each other and, cry with each other. And it was just amazing. And I still keep in touch with those girls, and I hope that I will forever. It really was great.
One additional thing I was just thinking about is also the setting of being around other people who were going through or had been through the nearly exact same thing that we had been, or very similar in what we were going through with infertility and a miscarriage as well, with 4 of the others having similar circumstances. It was a great setting that you could talk about amongst each other without having to explain a lot of things that you might have to others, close friends of yours that have never had infertility problems or don't even have children and don't want children or whatever the case may be.
They just don't get it.
They don't understand. They can't talk, about it the same way that you can with others who are going through the same thing. So that was, really nice to have that setting as well.
And that reminds me, too, that I thought of another thing that was so wonderful about the program that goes along with meeting other couples is you get some great advice that you just don't think of. Like, our last cycle was with injectable medications, and we talk about that in the group, and the girls would say, "Oh, try putting ice on your stomach for 2 minutes before the, or different techniques on where you can give the injection so they don't hurt as bad." Or one of them suggested treating yourself to a piece of chocolate after each injection as like a reward, and just some really fun advice that you wouldn't get from your friends at work. They wouldn't have any clue. So it really was great. I got so much out of it. I'm so glad that they recommended it.
Yeah, the communication one obviously was probably the biggest one.
Yeah.
But also, and it was her leading the exercises as well in those sessions also. She also did exercises to help us understand where maybe each of us were coming from. Men and women taking very obviously or vastly different approaches and mindsets to the problem at hand, and what the problems specifically were stemming from. Not just something small about your day that went wrong, and that's why you're flying off the handle at some point, or short with your loved ones or your wife or whomever. That there were obviously deeper issues, and not focusing or channeling your energy in the wrong direction, if you will.
Yeah, that was really
so that was another one that I remember being very good. In the very first session, there was a breathing exercise that we did together, and that certainly helped for relaxation purposes. So that was another one that we did together as well. Those are the 3 that stick out in my mind the most.
And then the one that she broke us off. Susan Leonard is the psychologist, and she's just wonderful. She broke us off like almost like junior high again. The girls in one room, the guys in another, and from what I understand, while the girls are on the room, we're of course talking about the guys in the other room. Like, oh, do you think our husbands are talking? No, they're probably all sitting there, and we find out later that no, they actually really got a chance to open up to each other, and it wasn't just about sports. I didn't know my husband could talk about anything that wasn't about sports. But and what we were talking about in our 2 groups was things that we wanted our spouse to know about how the infertility affects us, which was really great. It sounds so simple, but I guess we had never really talked about it before. We don't sit down at the end of the day and say, how is this affecting you? And what do you want me to know about what you're going through and how this affects you? And we did it as a group for the women and a group for the men. And then we got back together, and we had one person from each side read what we wanted them to know. And I know that when the guys read theirs, I teared up. I mean, it really moved me to know that that's how my husband felt. It's so simple that it took getting together in a group to find that out, but it really helps to know that. So that was a great exercise. And it was neat that the guys could actually, talk about how they felt about infertility with other guys. So,
certainly.
It was great. Wonderful.
Courteous, professional.
Thorough.
I can't think of a time where, and that's because there wasn't a time in which we ever left or even during any examination, any conversation, any discussion on future treatments or whatnot, that all of our questions weren't answered. Mm-hmm. He was extremely diligent in ensuring that we fully understood what it was and that we had no questions on whatever it was we were going to be doing or going through. I think even after he had an understanding that we understood, he still wanted to make sure that we were certainly all on the same understanding and had no additional questions, without a doubt.
Yeah, and I felt like he was more than just a doctor, or I don't know. He cared more than just a regular medical professional would care. I felt like he really wanted us to get pregnant, and when we did, I mean, I remember when we went in for that ultrasound to verify that there was a heartbeat, and of course they turn the screen away from you because they want to look first, and then they can, turn it back and tell you what they're seeing. And so while the screen was away, I'm just studying his face, like, what's he going to see? And, I'm waiting for that frown or that smile. And I mean, I swear, his face lit up. And it meant a lot. I could tell that he was genuinely happy for us, that he was so happy, like a friend would be, really, even. He was really excited for us that we got exactly what we wanted and our dream was finally coming true. And I have to tell a funny story about him, and you're going to laugh at me, I'm sure. But I also felt like he goes above and beyond where every other doctor does that I've ever seen in my entire life. And one example that sticks out in my mind is going through these infertility treatments. There were a lot of times we'd have to come in on the weekends for sonograms or blood draws, or all kinds of things. And on one Saturday in particular, we had to come in for a blood draw and sonogram. And sometimes Linda is the one that's here, and sometimes it's Dr. Goldstein. And on this particular Saturday, it was Dr. Goldstein, and he was drawing my blood, and I made the comment, I don't think I've ever had a doctor draw my blood before. I mean, it's always been a nurse or a tech. And my husband laughed at me. He said, well, why does that surprise you? And even Dr. Goldstein chuckled because I said it to him, and he said, well, I know how to draw blood. And I'm like, well, of course you know how, but I don't know any other doctor who does that. And I think that it wasn't so much that he was the one drawing the blood. I think it's more the larger picture, and that just sort of epitomizes it for me, that he there's just nothing he won't do to make sure that his patients get pregnant, or at least have tried every option possible.
Teamwork is maybe that there's a genuine understanding between each of them on what their primary objective here in this office is for. It's not just to make money. At least that's not the feeling I got, which it was to successfully get couples pregnant. And I know that Linda had at one point mentioned that when she came to work for Dr. Goldstein, one question she had for him was that, I can't work for you unless you support this mind-body clinic group session program. I can't work for you, basically. And he was in full support of it, and she's obviously here, and she's wonderful. But there was definitely a sense of a true understanding between all of them on how they want to approach infertility, and they're all on the same page. and they're all, wonderful in my opinion. And that's just one kind of example of something that stuck out to me, that the nurse is interviewing the doctor just as much as the doctor's interviewing the nurse. It sounded like, and that's good. That's a great thing. I think they're a tremendous fit, and it's and it's clear to me. It's very evident. So that's certainly something that sticks out to me.
Every time we come in, Michelle greets us at the window and, by my name. Hi, Allison, how are you doing? And no other doctor's office has ever done that, and you probably ever will. She was great. She was always very thorough, and, sometimes I had some odd questions for her, and if she didn't know the answer right off the bat, she would say, let me look into that, and I'll get back to you, and she always did. She always found the answer that I needed, so they really put my mind at ease regarding... Well, and it was overwhelming. I know also our first appointment thinking, how much is this going to cost us? And we don't know if we have insurance coverage for this. And they're willing to work with you. That doesn't seem to be a barrier for them. It's just one small obstacle to get around. So I really like the equipment that they use. I think that it helps make a somewhat unpleasant experience some of the time a little more pleasant. They use really great equipment, and they've just always given you a sense of comfort and ease. So all of my appointments went really well.
Yeah, everything was always clean, comfortable, tastefully decorated. I never came in and, I've been in many places where you might kind of be like, they need to, address that issue or whatever the case may be. And there was certainly never a time where I came in here seeing anything like that.
Oh, and one other thing about the equipment, sometimes when you go, especially with an OB or an infertility specialist in this case, the last thing you want to see is when you walk into the examining room is like some dinosaur piece of equipment that, you're just afraid to get up on that ice cold table and, scoot down on, or, something like that. And he's really got the latest and greatest when it comes to technology. Everything was very comfortable, and, chairs that drop down all different directions that I didn't even know existed to really make it a lot nicer and more comfortable. That makes a big difference. First thing is the Mind, Body, and Fertility program. I would recommend it to any couple struggling with infertility. It really changed my life. And secondly, if they don't already have a doctor, they should definitely come see Dr. Goldstein. And if they do, they should look into changing doctors to Dr. Goldstein's office. Everyone I know, I recommend them to. Even people who are going through infertility who already have a doctor. I tell them they should really check out this office.
Don't leave any stone unturned. There are many approaches, many different scenarios that come into play. For instance, for us, having a miscarriage never even entered my mind. Never even a thought. The only thought was that, to get pregnant and there, happily ever after. So that was very, it hit me like a ton of bricks. It's something we weren't expecting, and to be at least aware of what issues can come up, what possibilities there are, and once again, what kind of treatments and insurance coverages, and just to really do your research and know what all of your options are. And that's certainly, every question that we ever had was certainly answered here.
We've had a really great experience, and we're very excited.
Yeah.
To be having a baby in May.
The bottom line is that Dr. Goldstein and his staff have given us the one thing that we wanted most, and that is, a child that's due on May 15th. And we can't wait until that day.
We can't.